This is called as hematopoiesis or erythropoiesis, right? Formation of RBCs, right? Formation of RBCs. So what you will get questions, which RBC will be seen on electron microscope first? Okay, इलेक्ट्रॉन माइक्रोस्कोप पे मिलेंगी हमें सबसे पहले, that is probe. It is seen on electron microscope. Okay, it is seen on electron microscope. Then comes which RBCs will be seen on routine stain. Routine stain जो हम यूज करते हैं, right? What do you think? Answer is simple. If you know, take a look. सबसे पहले कलर कहाँ आ रहा है? Where do you see the color first? Polychromatic, right? Polychromatic. So it will be seen on routine stain. It will be seen on routine stain. Okay, routine stain में मिलेंगे. Then comes which will be seen on peripheral smear. Peripheral smear, in short, by the naked eyes, right? Microscope के नीचे हम blood stain लेंगे, so it should be seen. Where do you think? This is a mature form of RBC, right? So it will be seen on peripheral smear. Understood? One-liners है आने चाहिए. These are the 3 one-liners that you should know it. Okay? चलो. Where does erythropoiesis start? कहाँ पे RBC बनना start होता है? Anyone?
Bone marrow. Yolk sac.
Okay, it is seen. It start in yolk sac. Okay, main side or to start the erythropoiesis is yolk sac. Okay, कहाँ से? Mesoderm. Please read it carefully. Okay, examiners plays with the word if you know it. So it start in mesoderm. Okay, and the main site of erythropoiesis in a embryo, okay, or in a child which is in the womb is always going to stay liver. Okay, liver है. Okay, now comes physiology है, पेपर 1 में आएगा ये क्वेश्चन. रेड बर्न मैरो में कब स्टार्ट होगा? That is going to start from 17 weeks. It is going to start from 17 weeks. ठीक है. Now we will come for the diseases. Hemat है, so of course it is going to be anemia, right? Anemia. How do we classify anemia? By which parameter? One question comes directly from the classification. No, wrong. It is by mean corpuscular volume. Okay, mean corpuscular volume. What is the value of mean corpuscular volume? Normally, कितनी होती है? It is 100 to 80. Okay, 100 to 80. So we will divide this into 3 category. Yes, cell size इसी से define होती है. That is by mean corpuscular volume, right? So if it is in 80 to 100, normocytic, right? अगर सेल की साइज बड़ी है, that means MCV is more. more than what? 100. We will call it macrocytic, correct? And if it is less than 80, we will call it as microcytic anemia. Microcytic anemia. What are the examples of microcytic anemia? Anyone? Yes. It is not Seetal. Okay. It is not Seetal. Please remember this. Thalassemia and sideroblastic anemia. Okay. You can remember by the mnemonic list or lists, whichever you want to use. Okay. Lists or list, anything, whichever you want. Then comes microcytic anemia. What do you think? Which one are the microcytic? Any examples? Which drug causes macrocytic anemia? Yes. Drug. Favorite drug? Yes, it is methotrexate. Methotrexate. Hypothyroidism. Hypothyroidism. Beoda. Alcohol. Right? This alcohol will have sooner or later liver disorder. Right? Vitamin B9. Yes, that is which anemia? And B12 deficiency. Right? Vitamin B9 and B12 deficiency. And one more drug. That name of that drug is anyone? Phenytoin. Phenytoin. How you will remember? By the mnemonic Mahal. Okay. Mahal BP or Mahal BP, whatever, whichever you want to use. Now, the classification is over. How? Rest all. One question comes on a classification. If you are seeing the diseases or the drug from the given table, then it is microcytic or macrocytic. Rest all will go in normocytic, normochromic anemia. Okay. Some of you have used Seetal mnemonic. No, it is no more. Anemia of chronic disease causes normocytic first, then it will get converted into microcytic. Okay, so you have to choose this as an answer. Okay, this as iron. That is what written now, right? Sure. Understood. One question comes from this table itself, important table in hemat, so you should know it. Patient presented with headache, dizziness, pallor, okay, and she is a young age woman, and peripheral smear of blood is done, which is given below. What is the probable diagnosis? Young age woman presented with headache, dizziness, pallor, okay, and this is the peripheral smear which is given. What is the probable diagnosis? Young age woman, that's it, finished. It is iron deficiency anemia in India. No need to even look at the question. Answer will stay as iron deficiency anemia. Now, if you can take a look at the slide, what you are seeing, normally if you are doing a peripheral smear of RBC, okay, if you are doing peripheral smear of RBC, this is what it looks like. It will change to this. Okay, what has happened over here? Increase in central pale. इसका मतलब क्या हुआ? अंदर का जो व्हाइट पार्ट है, this white part is increased. Okay, is increase. इसी को बोलते हैं हम increase in central pale. Okay, remember this slide. This slide is going to mix with the all microcytic anemias. क्या बोला मैंने? ये स्लाइड वापस दिखेंगी in all microcytic anemias. So you have to look carefully when you are going to answer the question from microcytic anemia. Okay, what is this? The shape of RBC is little bit changed. इसी को बोलते हैं पोइकिलो साइटोसिस. इसी को हम बोलेंगे पोइकिलो साइटोसिस. ठीक है. Here also you can take a look. Okay, पोइकिलो साइटोसिस इसी को बोलते हैं. Now, what has happened in iron deficiency anemia? Anyone? Headache, dizziness था, fatigue, pale, pallor, right? And this pressure can have shortness of breath as well. These symptoms can present with all microcytic anemia as well. Okay, ये symptoms सब में होंगे. It is this like this. Okay, ऐसे दिख रहा है. ठीक है. दिख रहा है? दिख रहा है? डिफरेंस है. Okay, iron deficiency anemia. Now, tell me in iron deficiency anemia, if we will do investigation of iron profile. Iron profile करते हैं, right? So what we can see? कौन से टाइप के आयरन होते हैं? सीरम फेरिटिन, right? Serum transferritin, and there is something called as TIBC, total iron binding capacity. Iron deficiency है, right? Iron deficiency है. The main form of iron is serum ferritin, right? So ये क्या होगा? Decrease, right? If the main iron form is decreased, so of course the transport form, that is transferritin, will also decrease. लेकिन if iron is less in the body, so what our RBC will try, they will try to grab as much as they can, right? हर एक छोटा से छोटा आयरन हो उसे भी ग्रैब करने की कोशिश करेंगी. फॉर दैट पर्पस total iron binding capacity will increase. Okay, so on iron profile what you will see such picture. आयरन डिफिशियंसी है तो आयरन कम हो गया, बाइंडिंग कैपेसिटी ऑफ आरबीसी विल इंक्रीज, राइट? नाउ if they you have to choose a single best answer, single best answer will be this. It is most specific. Serum ferritin is most specific. Okay, क्वेश्चन में क्या ढूंढना है हमें? टीआईवी से, दैट्स इट, राइट? हमें ये ढूंढना है. व्हाट वी विल गिव आयरन सप्लीमेंट विथ फॉलिक एसिड, राइट? वी विल गिव आयरन सप्लीमेंट विथ फॉलिक एसिड. चले आगे. अंडरस्टूड? Patient presented with headache, dizziness, shortness of breath, pallor, and peripheral smear is done. Okay. Patient was on anti-TB drugs. Now he presented with this peripheral smear. What is the probable diagnosis? Take a look at this. Take a look at this blue dots which you are seeing around the RBC. Okay, around the RBC. This is called as cellar. Above that there is a deposition of something. It is called as basophilic stippling. क्या बोलेंगे हम इसे? Actually it is a deposition of iron. क्या deposit हुआ है? Iron has been deposited. Iron. In which condition we see iron deposition or basophilic stippling? It is seen in sideroblastic anemia. It is seen in sideroblastic anemia, correct? Deficiency of which vitamin? Remember like this. S goes for 6. So vitamin B6 deficiency. Okay, S goes for 6, vitamin B6, right? Now क्या हो रहा है यहाँ पे? Iron deposition हो रहा है. Case will start as a same like a iron deficiency anemia, headache, dizziness, pallor, right? But what will differ? First one is peripheral smear, and second thing is on iron profile. What you will see on iron profile? Anyone? Serum ferritin क्या होगा? Iron deposition हो रहा है, so of course serum ferritin level will be increase. So does transferritin level, right? Transferritin के भी level increase होंगे, right? Yes. Now if there is an abundant amount of iron present in the body, so what our RBC will try to do? They will decrease total iron binding capacity. So what you need to find in exam hall, right? If I am not going to give you peripheral smear, simple बोल रहा हूँ, ठीक है? Image no, no image in iron deficiency anemia as well. What you need to find? This one for iron deficiency anemia and this one for sideroblastic anemia, right? What are the causes? I gave you the hint. One causes क्या है इसके? Anyone? Isoniazide. Entity भी बोला था, right? Even one anti-malarial drug as well. Yes, chloroquine. Lead, correct. Daru and vitamin B6, right? Vitamin B6. Now take a look. I'm marking it. Alcohol can cause macro as well as microcytic anemia. Okay, understood? How you can remember? By the mnemonic Indian Cricket League Association number 6, right? Indian Cricket Association, Indian Cricket League Association number 6. Okay, you can use this mnemonic if you want it, right? Chal. Understood both? Okay, these are common questions. PSM people will ask, hemat people will ask, medicine people will ask. So you should know the hematology very well. Okay, 5 marks hemat से ही आते हैं. Patient presented with headache, dizziness, pallor, and on gums there is a bluish blackish line, and there is pain abdomen as well, and patient is disoriented. Question iron deficiency जैसा ही start होगा, the answer will change. What I said? Patient presented with pallor, headache, dizziness. There is blackish bluish line on the gums, and patient is disoriented. Or into patient is infertile. All goes to one answer only. Why do we focus on lead? It is used in so many things as well as in the medication as well. Antipsychotic drug hai, and in homeopathic tablets lead is used. So that's why you will see so many questions on the lead. What happens? You know the mnemonic already. I know that. Anemia, right? Headache, dizziness, shortness of breath, pallor, Burtonian line on the gum, ये वाली Burtonian line. पेन एब्डोमेन क्यों हो रहा था? कोली की पेन, राइट? कोली की पेन. यस. ड्रॉप्स, कौन से ड्रॉप होते हैं इसके अंदर? फुट ड्रॉप और रिस्ट ड्रॉप, राइट? Patient was disoriented. Reason? पागल हो गया है. Encephalopathy, right? So patient will have some kind of madness symptoms, right? and patient is infertile. That is called as fertility gone, right? So these are the things that you should know. क्वेश्चन कैसे घूम रहा है वो मैं तुम्हें बता रहा हूँ. अब क्वेश्चन सॉल्व करने 10 बार नोट्स पढ़ने से नहीं होती चीज. क्वेश्चन सेम स्टार्ट किए तीनों के, आंसर विच चेंज्ड अकॉर्डिंगली, राइट? याद है? I told you you will see same slide as iron deficiency anemia somewhere else as well. Take a look. Increase in central pale. Increase in central pale. Mila? Right? This is lead. What do you think? Patient, a child presented with decrease in hemoglobin. Okay, decrease in hemoglobin. He is having malocclusion of teeth. Malocclusion of teeth. X-ray of skull is done, and he is showing that military crew or crew cut appearance on X-ray. Peripheral smear is showing target sign. टारगेट साइन कौन सा होता है ये तो पता होगा यार, बताओ. दैट इज थैलासीमिया. थैलासीमिया. कौन से टाइप्स होते हैं थैलासीमिया के? टाइप्स. वन इज अल्फा थैलासीमिया. अल्फा थैलासीमिया. क्रोमोसोम नंबर. Chromosome number. Just calculate the alphabets which has been written in front of you. That is chromosome number 16. Calculate the alphabet. Answer is in front of you. इसके भी दो फॉर्म है, राइट? देयर आर टू फॉर्म्स ऑफ दिस. वन इज बार्ट डिसीज. It is the most dangerous. Most dangerous. Then come hemoglobin F disease. Hemoglobin F. See, most dangerous, that means patient will die in the mother's womb. इसी को हम बोलते हैं हाइड्रोप्स फिटालिस. हाइड्रोप्स फिटालिस. Hemoglobin F is most severe living form. This is जिंदा. जिंदा में सबसे dangerous is hemoglobin F. Bar disease will not survive. Okay, bar disease will not survive. Then comes beta thalassemia. बीटा थैलेसेमिया में क्या है? क्रोमोसोम नंबर. व्हाट डू यू थिंक? Calculate the alphabet of thalassemia. The answer is chromosome number 11. Chromosome number 11. Now, मैंने एक बोला था when I was giving you the question, there is crew cut appearance on the X-ray of skull. Can anybody tell me where you will find crew cut appearance except thalassemia? थैलेसीमिया छोड़ के और कहाँ मिलेगा? और वो तो निमोनिक हुआ है यार. Mnemonic is high nest, that is hereditary spirocytosis, iron deficiency anemia, neuroblastoma, G6PD deficiency, sickle cell anemia and thalassemia. इतनी जगहों पे crew cut appearance of skull will be seen. What is crew cut? In short hairs, right? Short hairs. Military के जैसे hair होते हैं, that is called as crew cut appearance or military cut appearance. Okay, इसी को हम बोलते हैं crew cut appearance. क्रू कट अपीयरेंस. ठीक है. थैलेसीमिया में भी थैलेसीमिया मेजर फॉलोड बाय माइनर. And this was your last to last attempt question. G6PD deficiency causing hemolytic anemia, crew cut appearance. याद रखना पड़ेगा. Has been asked and will be asked. Okay. I forgot to tell you what are the features, clinical features of beta thalassemia. अभी बताया था मैंने. Yes. Small occlusion of teeth, right? टेढ़े मेढ़े दांत, small occlusion, right? Frontal bossing, and one more, क्या होता है इसके अंदर और एक? Yes, chipmunk faces. Okay, chipmunk faces. These are all the clinical features of thalassemia. ठीक है. Try to answer this question. Pallor, शिस्टोसाइट्स. शिस्टोसाइट्स मीन्स हेलमेट सेल. इसी को हम बोलते हैं हेलमेट सेल. क्या ट्रीट कर रहे थे हम? पायूरिया. उसका मतलब क्या हुआ? इन्फेक्शन. इन्फेक्शन was treated. क्या मिला? शिस्टोसाइट. that means helmet cell. कहाँ मिलते? We will see it in G6PD deficiency. Take a look. This is called as helmet cell or bite cell or शिस्टोसाइट्स. इसी को हम बोलते हैं बाइट सेल, हेलमेट सेल और शिस्टोसाइट्स, राइट? किसमें? इन G6PD deficiency. कैसे क्वेश्चन आया? Now you got confused, I know that, right? न्यूबॉर्न था, इन्फेक्शन भी दिया है, एंटीबायोटिक भी दी है. All of you were thinking about antibiotic, but you forgot क्या लिखा है यहाँ पे? इन्फेक्शन लिखा है. And biggest hint, anybody can just answer by blind eyes, but everybody forgot this. Whenever you are getting question on hemat, please look at the hematological reference. मतलब स्लाइड जो दी है उसका रिप्रेजेंटेशन क्या लिखा है. ओके, हेमेट से क्वेश्चन आना है इसका मतलब ये नहीं दैट यू आर गोइंग टू गेट द इमेज एवरी टाइम. डिस्क्रिप्शन आता है, ये डिस्क्रिप्शन था. ओके, G6PD deficiency. What happens in G6PD deficiency? Anybody? This is called as Heinz body. Heinz body क्या बोलेंगे हम इसे? Heinz body. Okay. Now our splenic macrophages comes. Splenic macrophages will come and try to eat this deposition. क्या करेंगे? जो deposit हुआ है, macrophages will come and will eat this. Will eat this. Heinz body को खा लेंगे. And remaining cell, if you can take a look, it look like a bite cell. जो ये बची हुई सेल होंगी, that will look like a bite cell. Okay, G6PD deficiency. How happens? Causes? Anyone? Causes are infection. एक तो बता दो, अभी तो पढ़ा है हमने. Then comes one more anti-malarial drug. Anyone which you know? Primaquine. Chloroquine कहा था? Just try to remind again. Dapsone and one toxin, that is pavabine. You can remember by the mnemonic IPD. IPD follow. Okay, IPD follow. है ना, OPD IPD होता है, so IPD follow. These are the causes for G6PD deficiency. Try to answer for first question and second question. Then I will teach you the disease. It will be very easy after this. और ये क्वेश्चन पेपर में आ चुका है और आएगा आगे. And this is the commonest disease happens in ICU patients. Commonest anemia, you can say. Okay, I'm not saying most commonly, but it happens in ICU patient very commonly and get neglected because of doctor negligence. First one is which one and second one is which one. If some of your relatives were admitted in ICU, you would have heard something called as यार हीमोग्लोबिन बहुत ड्रॉप हो रहा है, बढ़ ही नहीं रहा. Hemoglobin is dropping but not increasing. Even after giving so many blood transfusion. Yes. क्या हुआ है इसके अंदर? फर्स्ट क्या हुआ है? राइट, क्या दिया है इसके अंदर? इन्फेक्शन है, राइट. infection. In second, what we are going to see, इसमें क्या दिख रहा है हमें? इन्फेक्शन. In this, cancer. CLL is blood cancer, right? क्या लिखा है और? The main hint is over here. Kumb test positivity. Okay, Kumb test positivity. Answer over here is autoimmune hemolytic anemia. Autoimmune hemolytic anemia. If you are saying infection, if you are saying what I'm saying, infection, the answer, remember, it is cold. Cold autoimmune hemolytic anemia. And if you are saying cancer or anti-cancer drugs, answer will stay as warm. Warm autoimmune hemolytic anemia. Okay, reason, it forms a complement अपनी खुद की immune system will create against the RBCs. Okay, complement system will be formed and it will going to kill the RBCs. Because of that, hemoglobin is going to drop. Okay, body खुद ही अपने body के against काम कर रही है. That's why hemoglobin is going to drop. Take a look. Warm autoimmune hemolytic anemia and cold autoimmune hemolytic anemia. Take a look over here. That means it is infection, right? Autoimmune disorder and lymphoproliferative disease. That means cancer. Okay. Then one-liner comes like this. Which immunoglobulin is going to cause warm autoimmune hemolytic anemia and which is going to cause cold? Okay. Who keeps you warm? Your girlfriend, right? So IgG, right? और दिल को ठंडक will always be given by your mother, Ma. Okay, right? So remember it like this. गर्मी कौन देंगे? गर्लफ्रेंड. दिल को सुकून या फिर आराम, फ्रॉम मदर. IgM. Treatment, what do you think? Treatment in autoimmune or cold autoimmune hemolytic anemia and warm, just remember like this. Steroids. क्या देंगे हम? Steroids. If steroid is not given, then we will do something called as splenectomy. Reason, macrophages are acting on our own blood cell. Macrophages कहाँ से आते हैं? Spleen से. So we will cut the spleen. That's it. And believe me, commonly we will give only steroids. No one is going to cut the spleen, right? Steroids ब्रह्मास्त्र है, they will act. ठीक है? What you will see in warm autoimmune hemolytic anemia, सेम है सेम. जितना याद रखने की जरूरत है, वी शुड रिमेम्बर दैट मच ओनली. बस इतना याद रख लो. तो उसमें तुम्हें हेमोलाइसिस एंड एग्लूटिनेशन कोई नहीं पूछने वाला. इट इज गोइंग टू कम एज अ हेमोलाइटिक एनीमिया. ठीक है, हर चीज नहीं पढ़नी होती. कंफ्यूजन क्रिएट होता है एंड हम प्रेशर लेते हैं. कीप इट सिंपल, कीप इट स्मॉल, स्टडी मोर, रिवाइज मोर, अंडरस्टैंड मोर. लाइफ विल बी इजी. ठीक है. If you will complicate everything in your studying material right now, believe me, कुछ नहीं मिलेगा डिप्रेशन के अलावा. डू नॉट कॉम्प्लिकेट द थिंग, कीप इट सिंपल. कम पढ़ो, अच्छे से पढ़ो. What you are going to see in warm autoimmune hemolytic anemia? Spirocytes, spherical shape, spherical shape. इसमें क्या मिलेगा? टेक अ लुक ओवर हियर. ऐसे नहीं लग रहा? ग्रेप का गुच्छा है, क्लस्टर्स ऑफ ग्रेप, इसी को बोलते हैं, राइट? क्लस्टर, क्लस्टर, राइट? क्लस्टर. एक के ऊपर एक है, एक के ऊपर एक है ना, ये स्लाइड में भी. दैट इज कॉल्ड एज रोलेक्स फॉर्मेशन ना. If you're not able to give anything to your girlfriend, give her autoimmune hemolytic anemia, so she can have a Rolex finally. She can have a Rolex finally, right? चल, अंडरस्टूड. ये क्वेश्चन आ चुका है, आएगा वापस फॉर श्योर. ट्राई टू आंसर, टेक योर टाइम. एक था शिस्टोसाइट्स, नाउ वी हैव समथिंग एल्स. व्हाट डू यू थिंक? As I said, if you are good with the description of the slide, the answer is finished. Crescent shape. Crescent shape means चांद, मून, इसी का मतलब होता है मून शेप्ड, right? They are not going to write down moon shaped. That is for your understanding. It is crescent shape. The diagnosis is sickle cell anemia, right? Now what they have twisted the question is like this. You have to choose the best answer, right? Crescent shape, sickle cell anemia. क्या हो रहा है? The RBCs are becoming sickled or crescent shape. So RBC के बदले RBC, खून के बदले खून. So best answer will be blood transfusion. Okay, the best answer should be blood transfusion. Now question can be twisted. Now what do you think, what will be the answer? The answer will be all of the above. Okay, answer is changed. Now the answer will be all of the above. Okay, कोई भी पेशेंट आएगा बस ब्लड ट्रांसफ्यूजन चढ़ा के तो नहीं भेजेंगे, राइट? फर्स्ट टाइम आ रहा है, राइट? इसी को हम बोलते हैं सिकल सेल एनीमिया. क्या बोलेंगे हमसे? सिकल सेल एनीमिया. क्या मिल रहा है इसके अंदर? मून शेप्ड आरबीसी. ओके, मून शेप्ड आरबीसी, राइट? और क्या मिलेगा? एनीवन? बस मून शेप्ड आरबीसी ही मिलते हैं ऐसा नहीं है. टेक अ लुक एट द स्लाइड. Everyone has a color notes nowadays, so have you looked at the slide properly? जूम करूं? हाँ, आपके लिए. हिंट चाहिए? इट इज नॉट हेलमेट. हेलमेट तो हेलमेट जैसे दिखेगा ना, राइट. Cell with a dot. Cell with a dot. Yes, correct. It is called as Howell, Jowl, Jolly body. Right? Moon shape के साथ Howell, Jolly body और Howell, Jowl body is seen. Right? Howell, Jolly body. Right? Now, what this patient will have? इसमें लिखा भी है वैसे. Mental problems, right? Mental problems will have this patient will be presented with mental problems. And can this patient have something else? Sickled है. आरबीसी क्या है? Sickled है. That means there is no proper oxygenation. ऑक्सीजन की लेवल कम होने वाली इस बच्चे के बॉडी में. Decreasing oxygen. Oxygen will decrease. Okay. उससे क्या होता है? Ischemia. Okay. Ischemia. और क्या हो सकता है? Thrombus formation. The patient can have congestive heart failure as well as dilated cardiomyopathy. Dilated cardiomyopathy. Okay. What are the other features of this patient? Take a look over here. It is called as, yes, fish mouth vertebra. क्या बोलेंगे हम इसे? कैसे बना समझ आ गया? Fish mouth vertebra. How it looks? Understood? चलिए. And patient can have these symptoms as well. Hand foot syndrome. Hand foot syndrome. Patient can present with hand foot syndrome as well. ठीक है. Differential diagnosis क्या होगा इसका? Anyone? Which virus? The name of the virus is Coxsackie virus. Okay, name of the virus is Coxsackie virus. Yes, correct. Now tell me, सिकल के अंदर कितने वर्ड्स है? That is 6, right? 1, 2, 3, 4, 5, 6, right? At position 6. At position 6. Glutamate gone. Valine welcome. At position 6. Glutamate will be replaced by valine. Okay, at position 6, glutamate will be replaced by valine. Yes, glutamate gone. G for gone. V for welcome. Okay, you can remember like this. ठीक है, चले. First tell me which is, okay, I will tell. Let it be. Normally in bone marrow, fat cells is equal to, means 50%, 50% with normal cells. What happens in aplastic anemia? This fat will increase. Where? In bone marrow it will increase. So क्या होगा इसके अंदर? This is actually aplastic anemia. Okay, this is normal. Okay, fat cells will increase, a plastic cell will increase. ठीक है, कहाँ मिलता है प्लास्टिक एनीमिया? ज्यादा पढ़ना नहीं होता इसके बारे में. स्टिल क्वेश्चन कैसे आएगा? पेशेंट वॉज टेकिंग सम पेन किलर. पेशेंट वॉज टेकिंग सम पेन किलर. फेवरेट सबका NSAIDs, राइट, पेन किलर. और पेशेंट वॉज वर्किंग इन अ some kind of factory that is heavy metal. हेवी मेटल कौन सा होता है? क्वेश्चन में आएगा तुम्हारे. पेशेंट हैज अ डेंटल एनामल गोल्ड साल्ट. ठीक है, सोने के दांत जिसके होते हैं, दैट कैन हैव, राइट. और पेशेंट इज हैविंग owl eye appearance, that patient can also have. Patient is having slapped cheek appearance, right. Patient is having again owl eye appearance. This all can have aplastic anemia. And this is the pneumonic. ठीक है, aplastic anemia किसी को भी हो सकता है. ठीक है, what do you think? What is this? It is a spherical shape, right? गोल है. So it is called as hereditary spirocytosis. Hereditary spirocytosis, right? क्यों होता है? डिफेक्ट किसमें है? बाइंडिंग प्रोटीन्स में, राइट. डिफेक्ट इज इन द बाइंडिंग प्रोटीन. नॉर्मल शेप ऑफ आरबीसी इज नॉट स्पेरिकल. गोल नहीं होती है आरबीसी. आरबीसी नॉर्मली ऐसी होती है, दैट इज डम्बेल शेप. ओवर हियर we will not see dumbbell shape RBC. What we are seeing, spherical RBC, that is due to defect in ankyrin followed by bind 3 protein. If ankyrin is not in the option, then you can go for band 3 protein. That is also not in the option. Then comes spectrin. Okay. What has happened? The shape of RBC changed. Okay. Shape of RBC changed. How it looks? It looked like an elliptical RBC. That is called as hereditary elliptocytosis. क्या बोलेंगे हम इसे? Hereditary elliptocytosis. It is due to defect in which protein? That is spectrin. Spectrin की वजह से होता है. ठीक है, चलो we will go a little bit faster. What do you think? It look like a grape cell, right? Grape cell cytoplasm. Grape cell cytoplasm. Yes, grape cell cytoplasm. सेल का नाम क्या होता है? इसी को हम बोलते हैं मॉट सेल. It is called as mott cell, right? Yes, Malveri भी बोलते हैं. The name is mott cell and it is seen in multiple myeloma. Multiple myeloma. And there is one more cell which is seen in multiple myeloma. Can anybody tell? Cell with a flame. जलने वाली सेल है ना, ऐसे लगेगा सेल जल रही है. The name of the cell itself is flame cell. क्या बोलेंगे हमसे? Flame cell. Take a look over here, right? It is called as flame cell. Why we are having flame cell? Anyone? It is due to deposition of what? IgG. IgG deposition happens in flame cell, right? What is the appearance of skull? Appearance of skull क्या है यहाँ पे? This is called as rain drop appearance of skull. ऐसा लग रहा है पानी गिरा है, right? It is called as rain drop appearance of skull. Okay, rain drop appearance of skull. Why we are having this rain drop skull? कौन से लीजन होते हैं बोन के? Anyone? आ चुका है, important है. Thalassemia and multiple myeloma are important. It is osteolytic lesion. Okay, osteolytic lesions होते हैं. So patient will present with which main clinical features that you can diagnose this is the multiple myeloma. याद रखना एग्जाम में, patient with recurrent fracture. क्या हो रहा है पेशेंट में? बार बार फ्रैक्चर होगा, रिकरेंट फ्रैक्चर्स. रीजन osteolytic lesions present है all over the body, even in the hands, even in the foot, okay, even in the skull, right, everywhere. So patient will present sometimes upper hand fracture, sometimes lower hand fracture, or sometimes fracture of something else. Okay, so ये याद रखना है. Osteolytic lesion है, so what will increase in blood? Increase in serum calcium level. कहाँ बढ़ रहे? ब्लड में, not in the bones. It is increasing in the blood. Reason breakdown of bone, right? Which kind of amyloidosis will be seen? Which kind of amyloidosis will be seen in multiple myeloma? AL type. Okay, which protein is going to be seen? Which protein? कौन सा प्रोटीन मिलता है इसके अंदर? बेंस जोन्स प्रोटीन. बेंस जोन्स प्रोटीन, राइट? यस, बेंस जोन्स प्रोटीन. इलेक्ट्रोफोरेसिस पे कौन सा स्पाइक मिलेगा? on electrophoresis which spike is seen? Yes, M spike. Due to which globulin? Sorry, it is due to, yes, globulin. It is due to globulin. Yes, IgG. Correct. Question दो अभी. Vitamin B12 deficiency. Vitamin B12 deficiency. Deficiency पे questions आते हैं. That can come in hemat as well. Female from a religious family, not eating meat. Okay, not eating meat. Now she is having difficulty in vision. Okay, unable to concentrate while studying, and altered mental status. Altered mental status. What is the deficiency in this patient? So what is the diagnosis? Again, I will repeat the question. Patient not eating meat, okay, having visual changes with mental impairment. Yes, vitamin B12 deficiency. Okay, क्वेश्चन बदलूंगा अभी यही देखना, ठीक है. पेशेंट नॉट ईटिंग मीट, विजुअल इम्पेयरमेंट, mental status is alert, on slit lamp, on slit lamp there is constriction of pupils, there is constriction of pupil, constricted pupil. कंफ्यूजन हो गया? जैसे आई एडेड वन मोर, कंस्ट्रिक्शन ऑफ प्यूपिल. प्यूपिल का नाम क्या होता है? कंस्ट्रिक्टेड प्यूपिल, बोथ साइड के. अर्जिल रॉबर्टसन प्यूपिल. द आंसर इज यस, दैट इज सिफिलिस. आंसर चेंज हो गया, राइट. अगेन सेम क्वेश्चन स्टार्ट करेंगे वापस से. यंग फीमेल नॉट ईटिंग मीट, visual impairment, altered mental status. On physical examination, he has S-shaped or curved shaped spine. What is the probable diagnosis? क्यों दे रहा हूं ये क्वेश्चन? तीनों क्वेश्चन पेपर में आ चुके हैं. So whenever you are getting question on vitamin B12, please remember, एक word अगर add हो गया, the answer is changed. Okay, what I am saying? The answer is changed. मुझे पता है, सबको पता है कि सब एक्यूट कंबाइंड डिजनरेशन ऑफ स्पाइनल कॉर्ड सबको आता है, सबको आता है. बट दिस इज द वे ऑफ आस्किंग द क्वेश्चन. ठीक है. सब एक्यूट कंबाइंड डिजनरेशन, विटामिन B12 डेफिशिएंसी, राइट. जो फीचर्स हमने ऊपर लिखे सेम, सब एक्यूट कंबाइंड रीजनरेशन ऑफ स्पाइनल कॉर्ड के फीचर्स प्लस अर्जिल रॉबर्टसन प्यूपिल. आंसर इज टोबेस डॉर्सालिस. इसी को हम बोलते हैं न्यूरोसिफिलिस. Okay, neurosyphilis. Vitamin B12 deficiency features plus pes cavus or scoliosis. Answer is changed. The answer will be पेड्रिक एटैक्सिया, okay, पेड्रिच एटैक्सिया। क्वेश्चन ऐसे ही आते हैं, that's why so many people get stuck in 140s to 150s, okay, याद रखना है इसे, करना है इसको एक्चुअली। दिस इज हाउ वी शुड डिफरेंशिएट एवरीथिंग फ्रॉम एवरीथिंग, अदरवाइज नोट्स पढ़ते रह जाओगे, आना कुछ नहीं है। Question has been come, this question came in your exam. What is the answer? Take a look at the cell. 1 2 3 4 5. 2 3 4 means there is a cell and the nucleus is connected, okay, ऐसे समझना है, क्या डेफिनेशन है वो हमें नहीं आई चलता है। देयर इज अ सेल एंड सेल का न्यूक्लियस इज कलेक्टेड, इसी को हम क्या बोलेंगे, मल्टी लोबुलेटेड सेल। मल्टी लोबुलेटेड सेल कौन से होती है? यस, द आंसर इज न्यूट्रोफिल, आंसर इज न्यूट्रोफिल। कौन सी है? It look like a kidney cell, right? Kidney shape लग रही, किडनी शेप, इसी को हम क्या बोलेंगे, मोनोसाइट। यस, it is called as monocytes, right? Monocytosis, anyone? Monocytosis is seen in which diseases? Bombay Municipal Corporation. Brucellosis, right? Brucellosis. M stand for, yes, malaria. And one more, that is cancer. यहाँ मिलेगा, ओके, यहाँ मिलेगा। इसमें क्या दिख रहा है? इफ यू कैन अप्रिशिएट ओवर हियर, दिस इज ओनली टू लोब्स, है ना, टू लोब। न्यूट्रोफिल्स कैसे थे? मल्टीलोबुलेटेड, बट इन दिस सेल वी आर जस्ट सीइंग टू लोब्स। क्या बोलेंगे हम इसे? बायलोबुलेटेड, बायलोबुलेटेड। कौन सी होती है? दिस वन इज, यस, इओसिनोफिल, इसको हम बोलते हैं इओसिनोफिल्स। एंड इओसिनोफिलिया, व्हाट आई एम सेइंग, eosinophilia is seen in National AIDS Control Program. Okay, it is seen in National AIDS Control Program. ठीक है, take a look. In short, जो न्यूक्लियस है सेल का, इट इज नॉट इन अ रेगुलर शेप, राइट? नॉट इन अ रेगुलर शेप, कोई शेप नहीं है इसका, What do we call it? We will call it basophils. We will call it basophils. ठीक है? This is easy, actually written also. Nucleus is almost taking the size of cell. ये cell है. Nucleus is taking almost the size of cell. Take a look over here. This is the cell, right? And the nucleus is taking almost the size, right? So it is lymphocyte. अभी थोड़ा hard लग रहा होगा. When you will get the PDF, just take a look. It is very easy. ठीक है? Now we come to main motive of taking the today's class. अगर ये आ गया मेरा काम हो गया. 1 mark at least it is fixed for sure. Try to read, take your time. Read कर लिया? Now I will give you the hints. हमें ऐसे solve करना है. 4-year-old. उसका मतलब क्या है? Children. है presented with fever, petechial spots and complaint of fatigue. इसका मतलब क्या? Fatigue हो रहा है, fever है. So what is going to happen with the blood cells? Sorry. इसका मतलब है pancytopenia. क्या मतलब हुआ उसका? pancytopenia. Every blood cell line is going to decrease. ठीक है? Every blood cell line is going to decrease. आगे बढ़ो. There is pallor, hepatosplenomegaly and sternal tenderness. Sternal tenderness. Whenever you are seeing the hint, child with sternal tenderness. What I'm saying? Child with sternal tenderness. The answer is always going to stay as ALL. क्या होगा? ALL. Okay? समझ आया? Child with sternal tenderness, answer is ALL. That's it. दिमाग नहीं लगाना. Take a look at the features. ALL के अंदर क्या मिलेगा? Children's. किसमें होंगे? It is going to happen in children's. And what I told you, what we will look? Sternal tenderness. This is the unique feature of ALL which you will not find in others. Okay, which you will not find in other. Now hepatosplenomegaly, fever, right, pallor, ये anemic के features है. That is going to be present there with everyone. ठीक है? pancytopenia हर एक में होगा. इसमें क्या हो रहा है? Sternal mass. And सब भूल जाओ. If you don't know the answer, mark the answer ALL. That's it. Okay? Any kind of genes, any kind of something which you don't know, the answer is ALL. Always. ठीक है? चिल्ड्रंस में मिलेगा। ये क्वेश्चन आया था तुम्हारे इसमें ही, पीपल वेर नॉट एबल टू अंडरस्टैंड। lymphoblast or pus positive cells will be present there. Okay, okay. पैनसाइटोपिनिया मिलेगा उसमें, हेपेटोस्प्लिनोमेगाली मिलेंगी नहीं ना, राइट। कैंसर के फीचर्स आ रहे हैं ना पूरे यहाँ पर, और ऑप्शन में वो डालेंगे नहीं, दिस विल नॉट बी देयर इन द ऑप्शन। ऑप्शन में ये होगा AML, CML, ALL एंड CML। पहले तो ऑप्शन देख के वो रूल आउट हो गया। इफ यू आर गेटिंग अदर क्वेश्चन, दिस विल बी नॉट देयर इन द ऑप्शन, लीस्ट लाइकली। अगर दोनों भी ऑप्शन में आ गए, you will see features of pancytopenia plus sternal tenderness, hepatosplenomegaly कहाँ मिलेंगी? We will see it in ALL, which is not present in costochondritis, right? Features of bone will be there or joints, right? Right? Good question, but answer change रहेंगे ना उसमें, totally different disease है ना, different topic है, ठीक है। इसमें क्या होगा, lymphoblast and pus positivity will be seen. So lymphocyte कितने बढ़ते हैं ALL में, lymphoblast है, right? तो lymphocytes will increase more than 20%, okay, more than 20%, ठीक है। now suppose उन्होंने क्वेश्चन दिया है, तो क्वेश्चन they have given you with image, just मैंने बताया था, if you know the lymphocytes, right, nucleus is taking almost cell part, right, पूरा सेल का न्यूक्लियस ही बन जाता है। सेम we will see lymphocyte, lymphoblast actually, lymphoblast with clear cytoplasm. We will see lymphoblast with clear cytoplasm. That's it. Okay. यहाँ पे कोई चेंज नहीं है सेल में, ऐसे समझ लो, सेम सेल दिखेंगी, ठीक है। रीड द क्वेश्चन अगेन। ALL समझ आ गया, स्टर्नल टेंडरनेस, आंसर इज ALL, चिल्ड्रन आंसर इज ALL, दैट्स इट। देन कम्स सेकंड डिसीज। क्वेश्चन तो समझ लो पहले। $50-year-old, right? That means adult, है ना, adult। गम ब्लीडिंग एंड फटिग, राइट। एक और हिंट है इसमें, दैट इज गोइंग टू मेक इट confirmatory diagnosis। whenever you are seeing MPO, myeloperoxidase, इसका मतलब ही है the disease has to start with the name M, okay? उसके नाम में M होना चाहिए, उसका मीनिंग ये होता है, okay? So कौन सा डिसीज है, सेल का तुमने अच्छे से पहचान लिया, यू नो द सेल नेम, आवर्स रॉड, करेक्ट, ये रॉड जैसा दिख रहा है, द नेम इज AML, okay, AML, okay। नाउ टेक अ लुक, क्या लिखा था वहां पे, ब्लीडिंग फ्रॉम द गम, रीजन, सॉरी Reason is gingival hypertrophy. जिंजीवा का क्या हो रहा है? Hypertrophy हो रही, right? And there will be also one more unique feature that is called as proptosis. What we will see? We will see proptosis. आंख बाहर आना. Okay, आंख बाहर आना. How you will remember? Just remember like this. ठीक है? आंख and M stand for mouth. Features of eyes and mouth, that is bleeding from the gum, right, will be seen only in AML. किसमें मिलेगा? AML. Okay. आंख एंड माउथ बोला है तो बस गम तो होगा नहीं, और कुछ भी होगा, राइट? Discoloration of tongue is called as chloroma. What we will call it? Chloroma. Okay, discoloration of tongue is called as chloroma. ठीक है, चलो. एंड एक ट्रिक है, कैच है. ओके, यू नो दैट sternal tenderness होती, mass on the sternum, right? But if you can take a look, इसे क्या बोलेंगे हम? इसको we will call it as redness on sternum. क्या बोलेंगे? Redness on sternum. क्या होता है ये? This is called as myeloid sarcoma. क्वेश्चन चेंज हो गया. ओके, रेडनेस ऑन स्टर्नम इज कॉल्ड एज माइलॉइड सार्कोमा. ठीक है, समझ आया? AML and ALL. If yes, then we will move ahead. Then comes CML. CML दोनों समझ आ गए. Now we are going to take care of CML. एक याद रखना, इसमें क्या लिखेंगे वो? Massive splenomegaly and age. Okay, massive splenomegaly. Hepatosplenomegaly is seen in everyone, but massive splenomegaly will be only seen in CML only. CML के अंदर ही मिलेगा. And the cell which is seen is pseudo-Gaucher cell. Okay, pseudo-Gaucher cell. Okay, the name of the cell is pseudo-Gaucher cell. CLL ये किस में मिलेगा? In adult, where we will see. Good thing is clinical cases doesn't come from the CLL, but still, if the question comes adult with tenderness on cervical region, adult with tenderness on cervical region, क्या मिलेगा इसके अंदर? सर्वाइकल लिम्फेडिनोपैथी. कैसे याद रखना है? याद ये रखना, C stand for cervical region. That's it. नहीं याद रहता, it's okay, but this is the way you should remember, right? सेल का नाम क्या है? The cell name is smudge cell. इसी को हम बोलते पैराशूट सेल. This is called as parachute cell. ठीक है, समझ आया? सर्वाइकल लिम्फेडिनोपैथी CLL, right? Massive hepatosplenomegaly, answer is CML. Arc and mouth involvement, answer is AML, right? Tenderness on sternum is ALL. That's it. ये hints पकड़ने हैं. Question can be one liner, question can be 5 liner. Hint is going to be there for sure. ठीक है. और ऐसा कोई पेपर नहीं जहां पर इसमें से क्वेश्चन आया नहीं. Okay, you can take any paper, question is there for sure. Okay, चल. Then comes bone marrow aspiration needle or bone marrow biopsy needles. Take a look over here. If needle is present with screw is called as salla. Okay, यहाँ दिख रहा है कहीं पे screw? नहीं. So without screw is clima. Okay, and if you can take a look or appreciate this one, it look like a T. It look like a T. So it is T handle needle. कहाँ यूज करते हैं हम? We use these needles for bone marrow aspiration और biopsy. ठीक है, ठीक है. चल, AML, CML वो lymphocytes के cancers, right? Now we come for lymphomas, OMA. Easy है, सबसे easy है topic. Don't worry, we will finish class soon as well. Type of Hodgkin lymphoma with best prognosis. What do you think? Answer. The answer is lymphocyte predominant. The answer is lymphocyte predominant. If lymphocyte predominant is not in the option, then the answer will be lymphocyte reach. Okay, if that is not in the option, the answer will stay as lymphocyte reach. Okay, now we will study lymphoma. कौन से होते हैं? There are two types, right? One is Hodgkin lymphoma, other one is non-Hodgkin lymphoma. Hodgkin and non-Hodgkin lymphoma, right? Hodgkin lymphoma are divided into which types? Anyone? Typical and atypical. Typical and atypical, right? Now how you will remember? जैसे मैं बोलूंगा वैसे ही. How many classes we have in a society? Poor, right? Middle and rich class, right? Upper class we call it, right? कौन से होते हैं? Poor, middle class और एक होता है rich class, right? But there is one more class which is of doctor class, right? पैसा हो या ना हो हमें करना है. Show off, right? Many of you have iPhone, right? iWatch, iPads, money in the balance, in account, ille, right? Nothing. But still we have to show up because we are doctors. So this is the class. So क्या क्या हुआ इसके? Lymphocyte poor, right? Middle class, इसी को हम बोलते हैं मिक्स्ड, है ना. Upper middle class and lower middle class are there, so these are mixed classes, mixed cellularity. Mixed cellularity, right? कौन सा बचा? Lymphocyte rich. And there is one more class that is called as show off class, is nodular sclerosis, right? Nodular sclerosis, nodular sclerosis. Now you will see these peoples in everyday life, right? You will see rich peoples, you will see poor peoples, you will see middle class people, and of course we are doctors, so you are seeing all show of peoples. But there is one guy which you cannot see in every day. Okay, you will see once in a life. That is called as Ambani class. क्या बोलेंगे हम इसे? अंबानी क्लास. That is lymphocyte predominant. Okay, इसके पास इतना पैसा है कि वो तुम्हें दिखेगा नहीं. Rich people you can see, right? You can see people with the BMW गाड़ी, right? But you will not see people with the Porsche car. That is the thing. So now tell me, who will have the best prognosis from the all the society classes? Who has a more money, right? Who has a more money will have best prognosis. So best prognosis will be with Ambani, right? If Ambani is not in the option, then what? Rich people has the money, right? That is the logic, right? So this is the answer for the question which we have discussed just. Most common class in India. Most common class in India is middle class. So most common Hodgkin lymphoma in India is mixed cellularity, right? Most common class in Western world is show off. They don't have money, but they think that they are richer. They have the good lifestyle. So most common class in Western world. That's why this class comes in all the textbooks written by the Western people. So of course they will write down as most common class in world, है ना? सब बुक वेस्टर्न लोगों ने लिखे. सो मोस्ट कॉमन क्लास इन वर्ल्ड विल बी नोडुलर स्क्लेरोसिस. ठीक है, चल. नाउ टेल मी, who can buy popcorns? Who can buy popcorns? Everyone can buy popcorn. Whenever you are taking girlfriend to movie, you can buy popcorn, right? But there is one guy who can buy popcorn with the heroine which is working in the that movie. मूवी के अंदर जो काम कर रही है उसको भी खरीदने की ताकत रखता है. कौन? दैट इज कॉल्ड एज अंबानी, राइट? सो पॉपकॉर्न सेल और ले heroine cell, LH cell is seen in Ambani. Okay, Le heroine cell will be seen in Ambani, right? And one more cell which is seen is lacunar cell. Lacunar cell is seen in show off class. Okay, that is seen in nodular sclerosis. Nodular sclerosis. Okay, ये हो गया तुम्हारा Hodgkin lymphoma. Did you understood this one? Easy है. Just remember the classes of society. That's it. Okay. Then we come to non-Hodgkin lymphoma. They are divided into B cell and T cell. किसमें डिवाइड किए? B cell and T cell. Just remember, many of you use filter to post beautiful pictures of yours on the Facebook, right? गोरा दिखना चाहता है हर कोई, चाहे वो 2 दिन से नहाया नहीं हो, बट फोटो में स्टाइल सब कुछ मानना है, राइट? सो रिमेंबर द निमोनिक. Facebook do make hairy adult marvelous. Okay, Facebook do make hairy adult marvelous. Adult T cell lymphoma or mycosis fungoides are T cells, T cell के. Rest all are B cell non-Hodgkin lymphomas. This is the mnemonic you should know. If mycosis fungoides is not treated on the time, it will go into which syndrome? That is Sézary syndrome. It will go into Sézary syndrome. ठीक है? माइकोसिस फंगोइडिस में कौन सा एब्सेस मिलता है? एनीवन? फर्स्ट, इट इज अ मिसनोमर. ठीक है, माइकोसिस यू विल थिंक लाइक दिस इज अ फंगस इन्फेक्शन, बट इट इज नॉट. इट इज नॉन हॉजकिन लिम्फोमा. मेक इट क्लियर. ओके, माइकोसिस फंगोइडिस में कौन सा अल्सर मिलता है, एब्सेस मिलता है? एनीवन? पोर्ट्रियर एब्सेस. M goes with P. Remember it like this. M goes with P. M goes with P. Now tell me, if the disease name start with P, that is psoriasis, which abscess is seen? The abscess name is Monroe's abscess. M goes with P. Okay, if the disease name start with M, abscess will be P. If P disease name start with P, abscess name will be M. Okay, दोनों पूछे जा चुके हैं. Controversial question of your exam. What do you think? What will be the answer? No need to even think what is image given below. Okay, wrong. ठीक है, just no need to think which image is given below. If it is written kidney transplant patient, answer is always going to stay CMV. ठीक है, बात समझ आ गई? Answer is always going to stay CMV. Okay, चल. Now I will tell you how to identify a outline. ठीक है, take a look over here. Whatever concept you have made, it is wrong. So please look. Cell दिख रही है? Okay, there is one big cell, a cell, ऐसा ही बना है, right? There is one big black dot or blue dot, whichever you want to say, right? And remember, inside the nucleus, ये nucleus है जो पूरा बना है, it is a nucleus. Inside the nucleus with big dot, what you will see, small dots. What you are saying? Small dots. Take a look over here. Nucleus, a big dot, and small dots. दिख रहा है? Nucleus, big dot, small dots. This is the outline which we will see in CMV. किसमें मिलेगा? साइटोमेगालोवायरस. ठीक है? Nucleus, big dot, and small dots. Answer is CMV. Okay. This is your Reed-Steinberg cell. Nucleus with only one dot. Nucleus with only one dot. Answer is Reed-Steinberg cell. कहाँ मिलती है? It is seen in Hodgkin lymphoma. Okay, Hodgkin lymphoma. I will draw it for you. Remember, as I said. ठीक है? Remember, as I said. ठीक है? यही याद रखना है. Still, see, everyone is not a clever guy. Even your examiner can make fool out of themselves. गूगल से इमेज उठाएंगे, गलती करेंगे. If you are getting a question which has written kidney transplant patient, always mark CMV irrespective of which kind of outline they have given. ठीक है? उसके डिटेल में नहीं जाना है. रीजन outline डालोगे. If you put outline of any kind of on Google, they will give all types of outline. So तुम्हारे पास क्या हिंट है? Kidney transplant patient. So answer will always going to stay CMV. ठीक है? कौन क्या पढ़ा रहा है मैटर नहीं करता. अगर उसने किडनी ट्रांसप्लांट लिखा है उसका मतलब ही उसको CMV चाहिए था आंसर में. दैट्स इट. सो कंफ्यूज नहीं होना. दिस इज कॉल्ड एज लैकुनार सेल. कहाँ मिल रही थी? इट वॉज सीन इन नोडुलर स्क्लेरोसिस. दीज आर ऑल, ये जो तीनों स्लाइड है, दीज आर ऑल टाइप्स ऑफ रिस्टिंगबर्ग सेल. ठीक है? लैकुनार कहाँ मिल रही थी? नोडुलर स्क्लेरोसिस में. एंड वी वर सीइंग अ पॉपकॉर्न लाइक सेल, राइट? पॉपकॉर्न सेल वेयर in Ambani class, right? That is lymphocyte predominant. Okay, lymphocyte predominant. Yes, correct. Take a look over here. अब इमेज कैसे समझी जाती है वो बताता हूँ मैं. It look like there are whitish big nodules formation, right? Whitish big nodules formation. Take a look over here. One nodule, two nodule, and three nodule. Sclerosis में क्या होता है? Whitening होती, thickening, right? Thickening होती, right? So nodules form हो रहे हैं. उसका मतलब ये है, ये क्या है? नोडुलर स्क्लेरोसिस. नोडुलर स्क्लेरोसिस, राइट? समझ आ गया? डिपोजिशन ऑफ कैल्शियम. कैल्शियम है इसीलिए ये व्हाइटिश दिख रही है. थिकनिंग हुई है. स्क्लेरोसिस का मतलब वही होता है. सो इट इज नोडुलर स्क्लेरोसिस. व्हाट डू यू थिंक? टेक अ लुक. One is one different colors are there, different types of colors are there, right? So it looks like mixing of colors, है ना? In short, different cells, है ना? Right? Different cells are there, so different colors are there. क्या हो गया? Mixing of cells, so that is called as mixed cellularity, है ना? एक कलर है, एक ये वाला कलर है, एक ये दिख रहा है, एक अलग टाइप का सेल है, ये भी अलग टाइप का सेल है. So this is called as mixed color, mixed cells, mixed cellularity. That's it. All cell line will be mixed. एक आंसर में क्या होगा? पूरे जितने भी टाइप्स के हमारे सेल है, that all cells will be involved. It look like a cell with a bigger follicles, right? एक बड़ा follicle दिख रहा है. Now you will think like ये तो ऐसे दिख रहा है जैसे नोडुलर स्क्लेरोसिस दिख रहा था, right? Nodular sclerosis. Popcorn is seen in lymphocyte predominant. ठीक है. Popcorn is seen in lymphocyte predominant and our lacunar cell, चांद, lacuna मतलब चांद होता है, moon, right? It is seen in nodular sclerosis. ठीक है, nodular sclerosis. And Ristingberg cell, that is owl eye cell, can be seen in all kind of Hodgkin lymphoma. Can be seen in all type of Hodgkin lymphomas. ठीक है, जितने भी पढ़े हमने उसमें सब में मिले. और जो नोडुलर स्क्लेरोसिस में और लिम्फोसाइट प्रीडोमिनेंट में हमें मिल रहा है, दे बोथ आर टाइप्स ऑफ रिस्टिंगबर्ग सेल. ठीक है, टाइप से, वो स्पेशल टाइप से उनमें मिलने वाले. What is the translocation which is seen in follicular lymphoma? Follicular lymphoma में which translocation we will see? Calculate the alphabet. Right? It is 14 and 18. Okay. Calculate the alphabet. You will see 1 from 14 or 18. You will see 1. So this will help you to catch the translocation. Maybe it comes. And BCL2 gene mutation. Okay. BCL2 gene mutation will be seen in follicular lymphoma. Child from Africa presented with jaw swelling and enlarged lymph node. Whenever you will see African child, khatam. Question is finished. B for black. Okay, B for black. Answer is Burkitt lymphoma. Okay, don't take time also. African child with jaw swelling. Answer is always going to stay Burkitt lymphoma. Question एक लाइन में खत्म हो गया. Now they will ask you translocation. बर्किट लिम्फोमा। बी है, add one more B in this. Now draw. Right? It look like a 8. So translocation is yes 18 14. Okay, कुछ ऐसा दिखेगा. Okay, it will look like this. Most common is this one. इसी को हम बोलते हैं, if you take a look at the sky, it is blue with white stars, right? White stars. इसी को हम बोलते हैं starry sky, right? Same is going to happen over here. A sky with white dots is called as starry sky appearance. Is called as starry sky appearance. Okay, remember? Marginal cell lymphoma. Chromosome number. Anyone? Chromosome number. Yes. Calculate the alphabet. Calculate the alphabet. How many alphabets are there? The answer is 20. The answer is 20. Okay. Translocation 11 to 18. Okay. 11 to 18. Which infection causes marginal cell lymphoma? Anyone? I am talking about infection. साइड में लिख देता हूँ. There is one more. Mantle cell सुना होगा तुमने. Mantle cell is 11 14. Which infection causes marginal cell lymphoma? Okay, which autoimmune disease causes marginal cell lymphoma? There was my when I was studying, there was my one colleague. Okay, so on that I have made the mnemonic. Okay, she was senior to us in age, so we used to add, we used to give respect. Okay, RA stand for rheumatoid arthritis. S stand for Sjogren syndrome. Okay, H stand for Hashimoto's. Thyroiditis. M stand for marginal cell lymphoma. Okay, IG stand for gastritis. Inflammation of GIT, right? Inflammation of GIT. So patient with gastritis will have marginal cell lymphoma. If you remember all the lymphomas which we have studied still now, कहीं पर infection आया था? Infection आया था कहीं पर? नहीं था, right? So this is the only lymphoma. Marginal cell lymphoma is the only lymphoma which can be treated with antibiotics. Which can be treated with antibiotics. ठीक है, समझ लो. आ गए समझ में? This is the regimes or the treatment of all the lymphomas. मगअप करना है. ATRA does not stand for atracuronium, which I have taught you in anesthesia class. It stands for all trans retinoic acid. ठीक है. These are the drugs which we will use. बस मेंटली होगा ना. गैस्ट्राइटिस दिया तो मेंटली मिलेगा ना, और क्या मिलने वाला, राइट? ठीक है. This was all the therapies which we are going to use to treat all the kind of cancers or lymphoma. ठीक है. Then comes vials. Vials. Vials कौन सा? इसी को हम क्या बोलते हैं? Vials को ही there is one more fancy word. Okay, fancy word का नाम है वैक्यूटेनर. Okay, वैक्यूटेनर भी बोलते हैं इसी को. Vials को वैक्यूटेनर बोलते हैं. Now you don't need to remember everything. I will give you hint. You will follow that hint. ठीक है. All kind of vials are not used, so of course they will not ask everything. Commonly used for CBC. Okay, complete blood count. Okay, complete blood count, blood grouping. Okay, and ESR भी तो CBC का पार्ट होता है वैसे, राइट? दैट इज EDTA वायल. लेवेंडर कलर होता है. लेवेंडर कलर के अगर वायल्स ना हो, इफ यू डोंट हैव लेवेंडर कलर वायर, देन वी कैन यूज रेड वायल्स. ठीक है. सो कुछ भी समथिंग रिलेटेड टू CBC comes, CBC related, answer is always going to stay lavender. Okay, something related to serum, for example serum calcium, right? Thyroid, serum calcium, serum potassium, right? Anything related to serum. Okay, urea, serum creat, right? Answer is always going to stay yellow wire. इसी को गोल्ड भी बोलते हैं, राइट? समथिंग रिलेटेड टू, यहाँ पे लिख देता हूँ सीरम. सीरम. something related to coagulation factor. For example, PT, INR, APTT, right? It is going to go in the blue aisle. ठीक है, it is going to go in the blue aisle. और एक याद रखना है इसमें स्पेसिफिकली डी डाइमर ब्लू आयल में ही जाता है. okay, something related to sugar except HbA1c will go in lavender. Something related to sugar will go in gray vial. Second question, before giving blood transfusion, what we should check of donor blood? ब्लड ट्रांसफ्यूजन करने से पहले कौन से वायरसेस हमने चेक करने चाहिए? Yes, these are blood-borne diseases. Yes, hepatitis B, C, and HIV. Okay, we should check for this blood-borne viruses or blood-borne diseases before giving blood transfusion. Okay, hope हेमेट समझ आया हो. Now what I want, a quick lookout in 1 hour before going to sleep. That is what I want from you today. 5 मार्क का सवाल है, आना चाहिए, इजी करके दिया है. Now please read it for 1 hour solve classical question, case based questions. Easy है, 5 out of 5 you can get. Okay, I know that I have left genes, वो थोड़े mutation का वो जो rectification का part है. My motive was to give you a hints how questions will come. इसको एक बार खत्म करो, 5 में से 4 तो आ जाएंगे यार, है ना? Easy है, right? So tomorrow we will meet. What you want me to take? Radio, or we should continue with the systemic or anything else? Of course, I will share the PDF. In the group, you can get the PDF. Tomorrow we will meet at the around same time. Okay. I am interested in everything. What do you like? Except Annette, I can teach anything. Okay. And please sleep before 1 o'clock. Try to sleep before 1 o'clock and try to wake up before 10. Okay. Okay, I will message in the group whatever we are going to take. Okay, I will share the PDF in some time. Obs Gynec I will take, but after some time. Okay, I will share one good PDF of differential diagnosis of all the diseases from gynecology. Just read it once. Okay, चले, ठीक, चलो, good night to all. See you soon.